Now, when you've given local anesthesia, you're going to need to make a recorded entry in Dentrix, our patient charting system. This screen shows you the chart of Liberty 11, which is one of our sample patients. So you're going to go to today's date, and you're going to click New Clinical Note. See this area where the yellow starburst is. And that'll pull up a new clinic note for the time and date that you click it at. Now, the first thing you want to be sure that you do is you know how much anesthesia you gave to your patient. So during the procedure and then after, during cleanup, as you're safely disposing of the needles in the sharps container without puncturing yourself and the cartridges, you're going to make sure that you look at each cartridge and find out how much you used in each cartridge. So for today, let's say we used 2 cartridges. We're going to write down 3.6 cc's, and we used 2% lidocaine. And this lidocaine had a vasoconstrictor, so it's with 1 to 100,000 epi, which stands for epinephrine, our vasoconstrictor. So we used 2% lidocaine. We used 3.6 cc's, which is 2 cartridges of 1.8 mLs per cartridge. Now, what injections did you give? We gave an IA, inferior alveolar, and a long buccal injection. And we did this on the right side, which is the quadrant 4 or the mandible. And then we write down what kind of needle we used. We used a 25 gauge long needle. And the last thing you want to make sure you write is, did you have any complications? And if you did, what did you do? This patient had no complications. And then you sign your chart. Now, for you as students, you're going to write your name, and then you're going to have your instructor and also the dentist on the floor sign for the day. So it's important that you make sure that you write down for each anesthesia experience, whether you're in clinic or private practice, how much did you use? We used 3.6 cc's, which is 2 cartridges of 1.8 mLs per cartridge. We used 2% lidocaine, which is right here, 2% lidocaine with 1 to 100,000 epinephrine. We did an IA and a long buccal injection on the right side with a 25 gauge long needle. There were no complications and the patient was released in good condition. And then you sign it.